The radial and ulnar arteries are key players in our circulatory system, ensuring a steady blood supply to the forearm and hand. As medical students navigating the intricacies of the human body, understanding their anatomy is paramount. This knowledge forms the foundation for clinical practice, from basic pulse checks to complex procedures. Imagine these arteries as vital pipelines, diligently delivering oxygenated blood to keep our hands functioning. Their intricate pathways and branches are crucial for nourishing muscles, bones, and tissues in the forearm and hand. Without these arteries, our hands would lose their dexterity and ability to perform even the simplest tasks. Therefore, mastering their anatomy is not just about memorizing facts, but about appreciating their vital role in our everyday lives. The radial artery embarks on its journey from the brachial artery, a major blood vessel in the upper arm. Branching off near the elbow, the radial artery courses down the forearm on the thumb side, staying relatively superficial. Along its journey, the radial artery gives rise to several significant branches. These branches, with names like the radial recurrent artery and the muscular branches, play a crucial role in supplying blood to the surrounding muscles and tissues. As the radial artery approaches the wrist, it takes a slight detour, curving around the lateral aspect of the wrist joint. This unique path makes the radial artery easily accessible for medical professionals. Clinically, the radial artery is a star player. Its superficial location at the wrist makes it the go-to site for measuring the pulse. Feeling the pulsation of the radial artery provides valuable information about a patient's heart rate and rhythm. Beyond pulse assessment, the radial artery is also a preferred site for arterial blood gas analysis. This test helps doctors assess the levels of oxygen and carbon dioxide in the blood, offering insights into lung function and overall health. Furthermore, the radial artery serves as a gateway for cardiac catheterization. In this procedure, a thin, flexible tube is inserted into the radial artery and guided to the heart, allowing doctors to diagnose and treat various heart conditions. Section 4. Unveiling the ulnar artery. The ulnar artery, the radial artery's partner in crime, also originates from the brachial artery. However, it takes a slightly different route, traveling down the forearm on the pinky finger side. Unlike the radial artery, the ulnar artery tends to run deeper in the forearm, often hiding beneath muscles and tendons. Despite its deeper course, the ulnar artery diligently gives off branches that supply blood to the muscles, bones, and skin on the ulnar side of the forearm. As the ulnar artery approaches the wrist, it joins forces with a branch of the radial artery, forming a critical connection known as the superficial palmar arch. This arch ensures a continuous blood supply to the hand, even if one of the major arteries is compromised. Section 5. The ulnar artery in clinical context. While the ulnar artery may not be as easily palpable as the radial artery, it is no less important clinically. It serves as a crucial backup system, ensuring adequate blood flow to the hand, especially if the radial artery is injured or obstructed. However, the ulnar artery's deeper location also makes it susceptible to certain complications. For instance, fractures of the bones in the forearm can potentially injure the ulnar artery, leading to bleeding or compromised blood flow to the hand. Therefore, understanding the ulnar artery's course and potential vulnerabilities is crucial for medical students. This knowledge enables them to anticipate and manage potential complications associated with trauma or vascular procedures. Section 6. Mnemonics for mastery. Memorizing anatomical details can be challenging, but mnemonics can make the process easier. For the radial artery, remember that it travels on the thumb side and is often used for taking the pulse. For the ulnar artery, remember it runs on the pinky side and is under the radar due to its deeper location. These simple memory aids can help solidify the key anatomical features of these vital arteries. These mnemonics, while simple, can serve as valuable tools for medical students as they navigate the complexities of human anatomy. By associating anatomical facts with memorable phrases or images, students can enhance their understanding and retention of crucial information. Section 7. Conclusion: Arterial knowledge, a cornerstone of care. In the realm of medicine, a thorough understanding of arterial anatomy is not optional, it's essential. The radial and ulnar arteries, with their intricate pathways and clinical significance, exemplify this principle. As future healthcare providers, medical students must master this knowledge, using it as a foundation for accurate diagnosis, effective treatment, and ultimately, compassionate patient care. From basic pulse assessments to complex vascular procedures, the ability to visualize and comprehend the course of these arteries is paramount. By grasping the anatomical details, recognizing their clinical relevance, and employing memory aids, medical students can confidently navigate the intricate world of the human circulatory system. This knowledge will undoubtedly serve them well throughout their medical careers, enabling them to provide the highest quality of care to their future patients.